Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Of endometrial biopsy in a reproductive age group female after transvaginal ultrasonography is first in a reproductive age group female with abnormal uterine bleeding. You have done transvaginal ultrasonography. After that, when do you do endometrial biopsy? Indications of endometrial biopsy in a reproductive age group female. When do you do endometrial biopsy? Endometrial biopsy is done in a patient if the patient has endometrial thickness of more than 12 millimeters, persistent bleeding despite treat or if there is persistent bleeding despite treatment, if risk factors for endometrial carcinoma or hyperplasia are present. In these cases, we should do endometrial biopsy in a reproductive age female. What are the risk factors of endometrial carcinoma or hyperplasia? The risk factors of endometrial carcinoma and hyperplasia include polycystic ovarian syndrome, unopposed estrogen in hormone replacement therapy, and granulosa cell tumor.
thank you and thank you for watching.